Welcome to Meet the Partners, Saving Lives in Partnership with Youth Engagement. My name is Jeff Bornstein, and I will be running this Dialogue for Health web forum with my colleague Merlene Tucker. We want to thank our partner for today's event, the National Overdose Prevention Network. Now it's time to meet the moderator of today's event, Dr. Carmen Rita Navarez. Dr. Navarez is the Public Health Institute's Senior Vice President of External Relations and Preventative Medicine, the Director of the Center for Health Leadership and Practice, and Director of Dialogue for Health for the Public Health Institute. She is also the Director of the California Opioid Prevention Network and the National Overdose Prevention Network. Welcome, Carmen.
Thank you so much, Jeff. So before we get started, I want to cover the objectives for today's short 30-minute session. And please, I want to encourage everyone, put your questions and your comments into the Q&A so that we can inform this conversation as we're going along with your thoughts and also try to answer your most pressing questions. So for today, what we want to do is just a really brief introduction, if you haven't already heard it, to the National Overdose Prevention Network. Talk about the role of youth engagement in overdose prevention. That'll be our focus for today. And also we're going to dive into how we can build effective partnerships with youth engagement organizations. Just so we can get a sense of who's in the room, we're going to do a quick poll, and I'd like everybody to please just click on where you fall in this category. Are you already partnering with, or do you represent a youth engagement organization? Your choices are yes, no, or I am a member of a youth engagement organization. So please go ahead and click your answer in there, and we appreciate knowing who you are before we really get into things. So first, let's talk about what NOPIN is and what we can do to support your work. In 2018, our team at the Public Health Institute Center for Health Leadership and Practice launched a statewide forum for all coalitions, organizations, and individuals working to combat the opioid crisis in California. Through that work, we've built a successful statewide learning network that serves 33 million Californians. Okay, you want to bring up the next slide? There we go. Yes, that slide there. Thank you. Our success is also based upon our experience running a National Leadership Academy on behalf of CDC, which has served more than 125 communities nationwide. Here's what we've learned about what it takes to drive local change for complex problems like opioid overdose deaths. The ingredients are strong partnerships. Stopping overdose deaths requires collaboration with key partners from your community. Leveraging assets already in your community. If you want better results from your efforts, bring together and help to galvanize the energy and the efforts of local leaders to implement community-driven initiatives that are aligned with evidence-based practices. Work across sectors by bringing everyone to the table. Adopt what works and don't reinvent the wheel. And we focus on key evidence strategies for overdose prevention. You'll see prevent, manage, treat, and stop framework in much of what we do. We're taking this work nationwide to help you save lives with partnerships, strategies, and resources for overdose prevention. So let's take a look at the poll results. Okay, so we have 50% of you out there, thank you so much, are already partnering with youth engagement organizations, and 6% of you are youth engagement organizations. So let's get the conversation underway and see how we can develop some concrete thinking about how to do even more work when working with youth engagement organizations. So I'm really pleased to welcome Graciela Razo, who's the Harm Reduction Coordinator at Safe Horizon, who and leads the Streetwork project in the Lower East Side of New York City. She began working in Streetwork in 2013, first as an overnight outreach worker, and then as a youth advocate running the drop-in center, and then as a case manager. For the past 2 years, she's been working at the harm reduction as a harm reduction coordinator, specializing in safer drug use, overdose prevention and reversal, as well as safety planning with homeless youth. Graciela is most passionate about working with street, homeless, and at-risk youth, getting Narcan kits into as many hands as possible, advocating for safer consumption spaces as a harm reduction tactic to prevent fatal overdoses. Graciela's focus is to provide unconditional love and support to homeless youth and to advocate for safer consumption spaces within expanded naloxone access. Welcome, Graciela. I'm so pleased to have you with us today. Would you tell us?
Thank you for having me.
Oh, great. Will you start by telling us a little bit about yourself and the role you play at the intersection of youth engagement and substance use?
Sure, yeah. So to give you all a little bit of context in which I'm doing this work, Streetwork is actually 4 different programs. So we have 2 drop-in centers. We have a drop-in center that I work at in the Lower East Side of Manhattan. We also have a drop-in center in Harlem, as well as a crisis shelter for young people under 21. And we also have an overnight mobile outreach team that provides services to folks right on the street and encourages them to come to our drop-in center for further services. So we're a harm reduction program, and we're also the only youth-focused syringe exchange program in New York State. So our model is a drop-in model, which means that we have, voluntary low threshold services for young people to come into our drop-in. Nothing is really required of them. They will have a case manager who can work on housing with them, benefits work, general counseling and mental health support. We also have food, hot food throughout the day. Food is a big part of the work that we do. We also have showers, laundry, clothing, hygiene supplies, mental health services, medical services, all on site. So as the harm reduction coordinator, I really work one-on-one with our young people on safety planning around different behaviors that can come with various risks. A lot of times that means substance use. So, that means that I am working with the young person on how to safety plan around safer use, overdose prevention, overdose response. And, we also can offer ways for folks to minimize their use, or whenever folks are ready, if and when they are ready, to stop using altogether. So we can connect them to various treatment options. We also have a buprenorphine prescriber on site that can, really help folks get on that kind of medication to stop using. But I think that, the work that Streetwork does is really addressing substance use from the minute you walk into the drop-in, making it a really, open and honest place to have conversations around substance use. I think one of the most important things we do is try to break down the stigma and shame that young people can feel around substance use. So, I think just having open and honest conversations is one of the most important supports that we can offer for our young people.
Well, that's quite a menu of options. I wonder if you would talk a little bit about how you got involved in this work.
Sure, yeah. So I've kind of had my hand in a few different social justice projects before I came to Streetwork. I was involved in like a citizen journalist social justice project in my early 20s. I've done work with food justice and farm workers' rights work. And so when I came to New York, I knew that I wanted to spend my time and energy doing meaningful work and just trying to support where I could. And, for those of us who have been at Streetwork for more than a couple of years, we always say that Streetwork found us. So Streetwork found me, and I was able to start doing this work as an overnight outreach worker, meeting young folks on the street and connecting them to our services. And it really inspired me to see how Streetwork really respects the autonomy of the young people we work with and advocates for them in any and every way that we could. And I had never really heard of harm reduction before I came to Streetwork, but it really clicked and just resonated with me in the framework that we help our clients. And so, I think that's really where the focus of my work came. I'm not a trained social worker. I'm completely trained by Streetwork and by the young people I work with. They have been definitely the biggest source of knowledge and information for me during this work. And, you know, one client in particular, who was probably one of my first clients on my caseload, really showed me the importance of harm reduction and, you know, seeing in the ingenious ways that she took care of herself. And, you know, when we found out about her passing from an overdose, it really almost broke me, honestly. But, you know, it really showed me that there is so much more work to be done. So that's how I got started doing this work. And that's kind of what keeps me doing this work.
So thank you for that story. I'm sure that was very, very difficult. But it certainly is something to learn from. Yeah, we have those experiences in this work many times over. Would you mind sharing a little bit about why youth engagement organizations and street outreach programs should be key partners, and what are some of the key successful approaches for partnering with them?
Yeah, so I mean, when you look at national overdose data and who is affected by overdose and who is also experimenting with drugs, you'll see that young people are the largest demographic. And so that means that those young people who are experimenting with drugs are oftentimes the most at risk. And so, you know, I think that youth engagement is key, and the way that we engage youth is also key. And so making organizations and programming that is specifically for youth is really critical in engaging them. I think it's, you know, not super effective to ask a young person to get support from an organization that primarily supports adults. So, you know, for us, making programming that is by and for the young people we support is really key. I'll also talk a little bit about the peers who I manage. Streetwork has a team of peers that goes out on outreach with us. They do different community events. And I think our peer team has really been a crucial part of our success because they are young people who are either current or former clients who have lived experiences using drugs. And so for us, I think that that's a really important part of the engagement and why we're so effective at our engagement. And also not only in hiring peers, but hiring folks with lived experience, hiring people of color, hiring people from the community in which we're aiming to serve. I think those are all really important things. But mainly having programming specifically for youth is really important in addressing the overdose crisis and trying to involve those young people in those safety planning strategies.
I think that's really important that you're talking about the role that youth are playing within your organization. And just sort of in response to one of the questions that's already been raised by the audience, I'd like you to talk for a moment about how do you build leaders? How do young people get to assume leadership and really take on some leadership within your organization? Do you have internships, employment, you know, what kind of volunteer opportunities? How can you help build up that opportunity so that young people can learn how to be leaders here?
Yeah, so I think one of my favorite parts of my job is managing our team of peers. They are critical in us developing our outreach strategy, letting us know where young people are congregating, where they're sleeping, where they're hanging out during the day. Also knowing what kind of support they need, right? And also seeing the trends that we see across the city as far as drug use and as far as overdoses go. They're really on the ground seeing it firsthand from their peers. So I manage a team of right now 3 peers, and one of my peers has been with us for almost 5 years. And those peers are the ones who are creating the literature that we create to go into our safer use kits. They are the people who are able to escort clients to appointments. And so their role in outreach and the harm reduction work that we do is just super critical. They also are participating in, we're interviewing for a few positions right now. And so they are the ones who are interviewing potential candidates to really see if our potential employees are grasping the idea of harm reduction and grasping the ideas of anti-racism that are really central to the work that we do at Streetwork.
That's so important. Thank you so much. Are they paid employees or interns?
Yes, they do receive a stipend. I honestly wish that they could be, wage employees. I think that the work that they do is, far surpasses the stipend that they get. But they do get some work experience. They do get lots of training from me and one-on-one supervision. So not only is it something, that they can put on their resume, but they get training certifications and they get real life work experience as well.
Yeah, that's very valuable for young people. That's that first step in the door to the next level of developing their personal world. I wonder if you could talk for a moment about some of the key challenges or pushback that youth engagement organizations face when they partner with other stakeholders around overdose prevention.
Yeah, in thinking about this question, honestly, so many things came to mind, but I think the biggest challenge includes when people are not respecting and honoring the autonomy of folks who use drugs, which are key principles of harm reduction, right? So I think many stakeholders and people who have good intentions, are really seeing the answer to the overdose crisis as treatment. And I think that's just a piece of the puzzle. And I think we really need to widen our lens as to what overdose prevention is. So for us, looking at the picture and the person holistically, we know that safe, accessible, and affordable housing is overdose prevention. We know that mental health care is overdose prevention. Community and connection are key parts of overdose prevention. Talking about safe supply and, like you mentioned in my intro, advocating for safer consumption spaces. These things directly address the overdose crisis. And I think we can also start to have more conversations about how racism and poverty and policing play a huge role in the overdose crisis. So I think starting to widen our lens more to see overdose as this bigger picture and this really societal failure that we are experiencing as opposed to somebody's personal failure.
Yeah, that's a very important perspective to bring in. Thank you. One of the strategies that you use is to normalize discussion around drugs and harm reduction supplies. So talk a little bit more about why this is so critical in doing this work well.
Yeah, so I think if somebody is feeling shame or stigma, there really is no gateway to talking about safer use. There is no trust to talk about safety planning or overdose prevention. So I think at Streetwork, that's really a big part of the overdose prevention work that we do, is to normalize conversations around drug use, to normalize conversations around naloxone and what safer use looks like. So everyone on intake is offered a naloxone training and Hep C testing and HIV testing, and everyone is spoken to about how we offer safer use kits and why we're a syringe exchange program and what that means. In the physical space itself, where I'm in my office right now, so you can see right behind me is all of our safer use supplies. So they're always out for folks to see. It's nothing to hide. It's nothing where, supplies are in a locked cabinet or anything. We have supplies out for folks to see, to ask questions about, and to make it readily accessible for folks. And so, by having these supplies just out for people to see, we're really normalizing conversations around substance use. And also in the space, we always have information about any fentanyl warnings or any spikes in overdose that we see in the city. We have, you know, signs about like, ask me about needle exchange and talk to me about naloxone. And, you know, we have all of these signifiers around the space to let young people know that it's okay to talk about your drug use here. We also have groups, harm reduction groups, where folks can talk about their drug use in a more informal group setting. So folks can also share their experiences with each other. So just opening up different venues for us to have those conversations has been, you know, a real key piece to overdose prevention for us.
So let's go a little bit deeper into the area of partnerships and you know, working with some of the other institutions that are around you. How you know, how have you been able to forge a relationship with your local health department?
Our health department is actually very supportive of the work that we do. You know, we have meetings with other syringe service programs around the city so that collaboration is easier. We also have partnerships with other syringe service programs within the neighborhood so that we can share information. We can refer clients to one another. So if, you know, the syringe program down the street is seeing young people coming to their space, they can refer them to Streetwork so that they can have a program that specializes in youth harm reduction. And so as far as our health department goes, they've been very supportive and yeah, just supportive in helping us form connections with other programs.
Mm-hmm. And then there's a really good question that's just come up. Before I get to that, I wanted to also ask you, how have you forged relationships with your local law enforcement agencies?
Law enforcement is tricky for us. It's an ongoing conversation, but to be quite honest, we have not had great interactions with police, especially considering that most of our clients and staff are people of color. So it's not a safe strategy to invite police into our space. And so because we are a confidential program, we don't allow police into our space. You know, over the years, we've tried to develop relationships with our local precinct. And, you know, honestly, we do everything we can to avoid calling the police if we ever need to. It's really exciting to see that New York is moving towards like emergency mental health care services, as opposed to when you call 911 for anything, police show up, because we've seen how not only dangerous that could be, but also how traumatizing it could be for staff and clients. So we honestly try to avoid calling the police if at all possible. But if we ever have to, we have a safety plan within staff to have a white identified staff member be the person to answer the door, to engage with the police if we ever have to. And that safety plan came after a pretty negative experience that we had with law enforcement.
Yeah, I think it's important to talk about these things, because everyone who's trying to run a program similar to this or contemplating this is wondering, how do they interact with government? And you know, what are some of the good things and what are some of the challenging things? And how can you build a relationship? And that relationship doesn't mean you call them in when you need to quiet somebody down or get rid of somebody, but a relationship is something deeper than that. It is a set of agreements that you form with some of these other organizations within government to make sure that your mission is understood and that you're on the street because, you know, people need not die. And that you can help in that way. I think bringing up the safety plan is also really, really very important. I can see that that's got to be an important aspect of this work. I want to get to the question that was brought up because I think it's really an important one. what do you do when young people come into your space under the influence, and what do you do if they purchase while in the space?
Sure. Yeah. So I love this question because, when we talk about this issue with young people doing intakes, they're always kind of surprised by how we answer this. And I think that speaks volumes. So people are allowed to come into our space high or drunk as long as they can maintain respect for the space, right? So we let people know that there is no substance use allowed in the space except for smoking cigarettes in our backyard. And that also now includes cannabis, since cannabis has been legalized in New York State. And so we say that off the bat because a lot of times it is safer for a young person to be high or drunk inside of our space, where we can monitor them, where we can safety plan with them, where we can get them water and food. And so oftentimes that is our drop-in is a safer place to be than for that young person to be outside on the corner by themselves, which might not be a safe thing for them to do. And so, yeah, being high or drunk is not an issue for us, again, as long as people maintain respect for the space. We also let folks know that people cannot buy or sell anything in the space. That includes a cigarette, headphones, drugs. Nothing is sold or bought in the space. And so we let people know that up front. If anything should happen, like somebody buying or selling or using in the space, we have conversations with those people as to why that's not safe for us here. We can't manage in our small space with a small staff checking bathrooms as often as we would need to if we allowed folks to use in our space. It's just a safety concern. So we always tell people, you can take care of yourself and take a walk and then come right back in. But it's just not safe for folks to use in our space.
Well, I really want to thank you for, for what you've brought into this conversation. I know it's only the beginning of a conversation, but having the connection to you and to your work and to the work that we're going to be posting from your center on this website with this tape in a couple of days, probably by the beginning of next week, hopefully. Everybody who needs to contact you to get some ideas or to really look at the kinds of resources you offer, have a conversation, those folks will be able to do that. So I really want to thank you for, for what you have brought into this conversation. Super important perspective. And I'd like to, at this point, and also let me comment that several people in the audience really, really thank you for being so honest and for being so, so candid in the kinds of things that you shared with us. It's not always easy to talk about some of the things that you need to bring into the conversation. So
thank you. And is my email going to be shared, just because I know it was a short conversation? So if anybody would like to connect with me outside, I'm more than happy to chat with anyone who's interested. Should I put my email in the chat or anything? Or?
That's a great idea. Put it in the chat, and we will also put it onto the follow-up page that we'll post that has the tape of this conversation and the slides of this conversation, and also some information that you've been so kind to share with us. So before we sign off for today, I just want to point out that for our next webinar, we're going to have in the Meet the Partner series a slightly longer conversation with Cindy Cipriani, who is the Assistant U.S. Attorney for Southern California, District of Southern California. A number of people have raised issues about, just how is the justice system organized around substance use, and what are the different parts, and who's this part and what does that part do? And so we thought, well, let's ask them to talk about that. So Cindy Cipriani will be with us in this next webinar to talk about it and to also answer your questions. And we're hoping for some more really useful, really, really helpful, thoughtful conversation. And having worked with Cindy before, she is very thoughtful. I think she'll bring a lot to the table. So I hope you all will join us then. And again, thank you so much, Graciela, for your work, for your dedication, for the passion that you bring to it. I know that all the youth that you touch really their lives really change because of you. So thank you for that. And then just finally, everybody, here's our webpage. Be sure that you sign up for the newsletter, or you can contact us at the contact box. And thank you so much for being part of this, this very quick session. Goodbye.